Mohamood's case was quite a tricky one because he had a childhood infection when he was 2 years old, and we don't know exactly what infection that is when he was in Somalia. Some kind of soft tissue destruction happened because of that, and the whole nose, the mouth cavity, and also the larynx was affected. So when he came, he had noisy breathing, and eventually he developed grade 4 kind of glottic stenosis, and he was put on tracheostomy tube, and there was a suprastomal granulation as well. So when I got the child, there was a couple of challenges. First one is to extubate the child so that he can start breathing again through the nose and he can live without the tracheostomy tube safely. The second was to give him back his voice. So we took the challenge, and the parents had trust on our team, and we did it with the help of ablation and balloon dilatation. There were a couple of sittings in the OT. Like first we kind of cleared the glottic part and the granulation tissue. Second and third stage we used to check him with the endoscope. Repeat balloon dilatation was done, and at the end of 3 weeks we removed the tracheostomy tube, and by God's grace the child is doing well and he got back his normal voice within a month.
My name is Aline Abdul Fattah, and this is Yahya Mohamood, and this is his son Mohamood, and they want to bring forward gratitude for the hospital, Medicover Hospital, and Dr. Sampurna for the successful surgery of removing the tracheostomy tube. So welcome to the side.
ما شاء الله سفعنا وأركز سيدا هوري يسيدا هدا كفعنا هوش.
He said the way he was before and now it's better now. كمان حالة سبب وشلوها.
سيدا أول هاي معناها أول هو هاي عنك سائل وهاي مبتعدنا الحمد لله اختار ده وناس.
ما خلدنا.
ما هو حق خلدنا لونتا لا سبت لونت ويرد.
Okay, he said before he had one problem, he couldn't breathe without that tube, and the air tube was very narrow, so the doctor scheduled the surgery for making it wide, and so that the baby can breathe without the tube and he can also speak. And before he couldn't speak, he couldn't breathe without that tube. After removing that tube, the procedure was successful. Then now he can speak and also he can breathe normally. marka maxaad leedahay isbitaalka aad ku leedahay dhakhtaradii isbitaalka?
ما شاء الله waxaan ku leeyahay dhakhtarada aad u fiican waay waa dhakhtarad oo macnaha ku takhasustay macnaha wax qabadkeeda zaid yahay waxaan leeyahay inay hor u socoto.
Okay, also he's thanking for the doctor for that surgery, and he's also telling his other fellows if they need something like that, if they need to come for any ENT problem, they are welcome here. She's very well experienced doctor. And the other thing I want to tell you also, he's here in India for 11 months now. He went to a lot of ENT doctors, all of them. They said this surgery is very risky and maybe the baby cannot survive from that surgery, but successfully the doctor tried, and hopefully with the help of Allah, now the patient is well and also he's free from that tube.